Can you guys see the presentation?
Can see that. And if folks have questions during your presentation, I will let you know. So don't worry about moderating or monitoring the chat.
Okay, just let me know if there's any issues. Uh, of course, Stephanie's already introduced me. I'm a 100% service-connected veteran. So when I came back from Desert Storm, Desert Shield, I I got some sound from somebody.
Melanie Kearns, if you could mute your mic, then that would be great. Thank you so much.
Okay, so when I came back from Desert Storm, Desert Shield, I dealt with PTSD myself. I dealt with panic disorder, depression, dealt with quite a few other mental health issues during that time. When I returned, one of the biggest challenges in rural West Virginia in Logan County was the fact that there was not a lot of help. Um, People were kind of preaching and teaching getting help for mental health. And I think that stigma still applies even today for a lot of individuals going through mental health, that they do not realize that it's okay for them to reach out and get services and get help. PTSD is something very near and dear to my heart. Not only have I experienced it personally, but I have worked with several clients of mine through professional counseling to overcome PTSD, panic disorder, depression, and the different things that follow. So let us take just a little bit look at PTSD. If I can get my screen to share. Uh,
We are seeing your screen. If you are you able to advance your slides?
no, it's not wanting to advance my slides. So let me try something else here. How about that? Can you see that now?
No, we cannot see that.
Okay, so let me go back into, yeah, it's having, let me try it again. Let's see if it'll let me do it this way. Okay. So when you're looking at PTSD, you can kind of see that there's quite a few symptoms and triggers that when we look at it. So when we think about people with PTSD, we know that there's a feeling of being numb, uh, and they're not able to always express their feelings or their emotions. They avoid situations. I can tell you personally that family affairs, a challenge for me. Um, Going out to things like Fourth of July with the fireworks, watching military shows or anything that dealt with death and dying on TV was a challenge. So we had to make sure that, whenever I was going to a function or situation, I needed to know what was going on for my comfort level. We also know that a lot of veterans with PTSD and a lot of individuals, PTSD doesn't just come from being a veteran. Also, it comes from multiple things that produce trauma. So some of these people, when they go to restaurants or places like that, they avoid sitting with their back to other people. So they make sure that they can sit in places where they can scan the area, make sure that they're safe. People with PTSD relive the event. So for me, I can tell you that I was on the road where all the bombing and stuff took place during Desert Storm, Desert Shield, and not a day goes by 30 years later that I don't see different scenes and different situations that I was put in while I was there. I do not even have to close my eyes to still see all the bodies and all the destruction that took place there. So reliving that event, sometimes that occurs through dreams, sometimes smells or sounds will trigger those events. So we have to be mindful of that. So if you notice an individual whose attitude or their demeanor is changing while you're with them at an event, they may have had something that has triggered their PTSD. Some of the things we think about as far as therapy, creative arts. For some individuals, they love photography, painting, drawing, and writing. Some non-traditional is things like yoga, acupuncture. Music is a good tool, but I warn people about music, thinking about the message that the music itself is producing. For example, I wouldn't want to listen to music that talks about death and dying, or I don't want to listen to music about someone taking my wife and running away, things of that nature, because instead of that improving my mental health, it's going to increase my issues. Some people use physical activity like fitness and recreational activities like camping, boating, fishing. Laughter is a good tool. I love to watch comedy and cooking. Now, for me, and I know this may seem weird for some people, but one of the things that really worked for me with my PTSD is when I went back to college. And so college courses helped me a lot with my anxiety, my depression, and all the things that I went through. And you'll find that I continue to go to classes more and more because it's very therapeutic for me. Then, of course, you get into other treatment styles of prolonged exposure therapy, selective serotonin inhibitors, cognitive processing therapy, and eye movement desensitization and reprocessing. For me, I'm a very big cognitive therapist, so I use CBT a lot. I use a lot of reality therapy and narrative therapy to work with my clients. Let's see if I can get this to advance again. Can you still see that screen?
I see your email.
Oh, man. So it's having a hard time sharing if I'm not in full screen mode. I don't know what's going on with that.
If you're in full screen mode, are you able to advance through?
Can you see that there?
Yes, we do.
Okay, so I'm going to do it this way because it's not letting me advance my slides when I do it in full screen mode. All right, so for a lot of veterans and for individuals who have PTSD, from car wrecks, loss of life through suicide, all the various trauma things that can trigger PTSD, the biggest thing is admitting that you have PTSD. For me, I really didn't know what it was when it first began. And so it was a challenge for me to identify and recognize what it really was. So it's a sad fact that many soldiers are worried that admitting to combat PTSD can harm their careers in the military and in civilian careers. So I can tell you personally, one of the experiences that I had from that situation, when I first was going to the VA to see my therapist, and I mentioned that I had PTSD issues, but I was also working in the school system, I got some very, very funny looks. And so sometimes mental health professionals reinforce the ideal that you should not admit that you have issues with PTSD, that you should not admit that you have issues with mental health at all. And so that becomes a very big factor. Some military veterans fear that others will look down on them if they admit to combat PTSD. So they don't want to be seen less of a soldier or less of a man or less of a woman. So the lack of knowing what treatments are available or accessing the treatment. One of the things that I do like about the telehealth treatment now is that it gives, a more confidentiality. So I can talk to my therapist and no one knows because it's in the comfort of my home. I'm not seen at the VA or I'm not seen going into a mental health clinic. So I do appreciate that is there, but I'm finding that a lot of individuals still do not know that option is available. So making sure that they understand that confidentiality can still be kept and that some of these fears here would not have to be realized or dealt with. And then we think about how hard it is because people are expected to be able to handle traumatic events. I know working with different people who have trauma issues, sometimes their family have the attitude of just suck it up. You should be over that by now. You shouldn't still be dealing with that. That's so long ago. For myself in particular, it's been 30 years since I've been to Desert Storm. And so my family would expect me just to be okay. And for them, it's easily forgotten. But for me, it's still relived. And so you have to keep that in mind for individuals, that even though there may be time in between, people who have issues with PTSD do not overcome that with the experience of time. For someone who time makes a big factor, generally it's not an issue of PTSD. It's a factor of that just at that moment they had a traumatic experience. Their body was able to process through it, and they got beyond that. So sometimes PTSD makes some people feel isolated and make it hard for them to get help. I know for me, when I was really experiencing my PTSD, a lot of my family avoided me themselves because they didn't know what to say, they didn't know what to do, they didn't know how to help. And so that becomes an issue. Being able to talk with people who have things in common, who you feel can understand. One of the things that was challenging for me, and I know is for a lot of individuals, is if you do go to a professional who has not experienced PTSD themselves, but have just taken classes or read in a book, you don't always feel as validated or heard. And so sometimes that makes it even harder when you don't feel like people's hearing your pain or your struggle. People don't always make the connection between trauma events and the symptoms like anxiety, anger, and possible physical symptoms. One of the things that I listened to a psychologist say in a training that I took part in that make a lot of sense. For someone who is truly going through PTSD issues, their level of nonsense changes. And what I mean by that is this. In general, your average person worries about typical things that are around them in the world or in their families. And so they sit around and they talk about and they worry about those things that now people who have PTSD look at like that's insignificant to me. Now they have a different level of seeing things. So it's hard for them to connect and communicate. So that's why you'll see them pulling away from individuals and people. Anger is a big piece of it. And I think a lot of that comes to the fact that your anxiety is so high, and you're at that level to where it doesn't take but just a little bit to push you over. And so that anger comes out quicker and faster. People often have pre-existing anxiety disorders or have suffered prior from depression or substance abuse. And so that increases that risk factor if they've had those issues before. And so it's a struggle of knowing what works, what doesn't work, what is PTSD, what's not PTSD. So really understanding those signs and symptoms and helping individuals who's going through it to understand them is a big factor. One of the things I like this screen here because I like the little picture of the man tied up in the ropes, and I like this mnemonic. It says trapped, and that's exactly how you feel when you're going through PTSD. You feel trapped. And so the mnemonic breaks it down for you to help you to understand. The T stands for the trauma piece. The R stands for the re-experiencing piece. The A stands for avoidance. The P, physical and psychological anxiety. And the D stands for depressive thoughts and moods. And so I like this as a good memory thing because, like I said, it really does make you feel trapped. You feel like you don't have an escape. You don't have any help. You don't have anywhere you can go. And I can tell you that when it first began, I was so disabled that I wasn't able to work. I wasn't able to supply for my family. I lost everything that I owned. So I've lived without food. I've lived without water. I've lived without heat. And all of that stuff made me feel trapped. And by that in itself magnified my depression. It magnified the fact that I had lower self-esteem. And so it was a struggle and a challenge. And during that time, of course, if your partner, whoever that you're with during that time, doesn't understand some of those issues, then it causes those marital issues and trouble. So we're going to get into that a little bit later, how it impacts the family as well. Just making sure, I'm going to check real quick to make sure there's no questions or comments, Stephanie, before we go forward.
I don't see any questions at this time. Thank you.
All right, thank you. All right, so some of the myths that prevent people from seeking trauma therapy is PTSD only affects war veterans. As I mentioned earlier, that's not true. PTSD can affect anyone who has experienced a traumatic event. It also can affect individuals who are not directly in the event, but who are close in relation to someone who was in the event. So one of the case studies that I read during college talked about a young lady whose best friend was raped on a college campus. The young lady who was the best friend developed PTSD from the story of her best friend because they were so closely related. And so that's very possible. So keep that in mind. Just because the person who has the traumatic event, everyone's not affected the same. If you've ever read the book, The Body Keeps the Score, inside of that book, it really, really breaks down and talks about how the different individuals process or go through a traumatic event. And so I found it very insightful. I will give you a warning, though, that there is some language and stuff within that book if you read it, but it's very powerful if you'll just look at the content and the science studies behind all the traumatic events. Another myth is people should be able to move on with their lives after a traumatic event. Those who can't cope are weak. We know that that's not true. Regardless of the traumatic event, everyone deals with death and dying differently. Everyone goes through those stages of grief differently. And so everyone sees the traumatic event from a different point of view. So we do have to think about some of the contributing factors when we look at those things. And so I think about, growing up, what was some of those factors that instilled that resiliency inside of that individual? Does that individual have good resiliency? Were they lacking in some of those areas? Did they not learn early on? Those can also be a risk factor as well. But I know strong people who had good resiliency all through their life, who handled a lot of different things. It's just a traumatic event that was just so overwhelming for their mind and so overwhelming for them that they still went through PTSD. Another myth is people suffer from PTSD right after they experience a traumatic event. That's not true. Generally, PTSD, you want to give at least about a 6-month period. If that individual is still dealing with that after 6 months, then you may really need to start looking at PTSD. But most of the time, for individuals who experience any traumatic event, it will take them several months to reprocess, to work through that, and to get back to some sense of normalcy. Trauma exposure is common among both men and women. Generally, it impacts 60% of men and 50% of women. Of course, we know during the pandemic, during COVID, 40% of U.S. adults experienced anxiety or depression. And so that became a big contributing factor. And I can tell you personally that I've seen numerous treatment plans come out and numerous treatment facilities come out past the pandemic of COVID because mental health issues have increased dramatically. And so the ideal of needing that help has been brought to light even more. But not only adults, but I work with children too. And a lot of children had even reached a point where they had thought about what's the use of going on? There's not going to be any hope. There's not going to be any future. And so it's been a real challenge even for our children. Some of the things we have to think about as far as PTSD is that comorbidity, because not only do people experience PTSD have issues with that, but a lot of times there's other mental health problems that occur. And so we have to think about here, it says 80% have one or more mental health problems like depression, anxiety disorders, and substance use disorders. A lot of times the substance use disorders get magnified because it becomes a coping mechanism. 20% have no other mental health problems other than the issues related to PTSD. And that is just based off of what's being reported. I think about all the individuals that are out there who are dealing with PTSD who have not reported. I would have been one of those individuals in the beginning of my stages of treatment. I did not report for many, many years and did not seek help for it. So I know that number could be even higher. Approximately 70% of adults in the United States have experienced a traumatic event at least once in their life, and up to 20% of these people will go on to develop PTSD. Now, for me, when I look at that number, that gives me a sense of hope because, that tells me that 50% of those adults went back to a normal life and PTSD did not overtake their lives. It's estimated that 5.2 million adults ages 18 to 54 have PTSD. So that's approximately 3.6% of our population. So there's a lot of individuals out there dealing with it. So understanding and knowing how PTSD impacts other individuals is extremely important. Women are about twice as likely as men to develop PTSD. Some of the reasoning behind those vary. Some of the thought process varies on that. But as of right now, I think that a lot of that has to do with the fact that more women probably report than men. I'm not going to get into that men versus women factor of this one's more superior than the other. I don't go into all that stuff, but I think it has to do with a lot of the reporting or the willingness to seek treatment. Approximately 30% of Vietnam veterans developed PTSD at some point after the war, and 8% after the Persian Gulf War. With Afghanistan and the wars that are going on now, that number has increased. I don't have the percentage, but one of the things that changed for those gentlemen compared to the other wars was the fact that there was no place that we call a safe zone. So everywhere they were at 24/7, they were in a place that they could be harmed. When I was in the Persian Gulf, we did have an area that we called back in the rear where you kept a lot of your medical people, a lot of supplies and things. There was not always a sense of danger in those areas. There was a little bit more comfort, but the veterans going to wars today do not have that same opportunity. So you're going to see a more increased hyperarousal. You're going to see more increased issues with anxiety and reliving those traumatic events. PTSD impacts in many different ways. The area that has had a large increase of individuals, of course, is the armed forces. We should also think about our medical people right now with all the different COVID situations, our firemen, our policemen, those first responders. I guarantee you that it's impacting all of them. Sexual abuse survivors constitute a large number of PTSD victims. And we know that sexual abuse is happening more and more rapidly. Children and adolescents who experience childhood trauma as a result of childhood physical, sexual, or emotional abuse suffered at the hand of abuse, neglectful, addicted, or mentally ill parents or guardians. I know in my county that over 50% of our kids are living with someone other than their biological parents. And so I know that that trauma issue has increased. 39% of those who live with a veteran who is struggling with post-traumatic stress disorder will develop what is known as secondary PTSD, also known as STS or secondary traumatic stress. I also caution anyone who's working with individuals who have PTSD that to be aware that secondary PTSD can also impact your lives. So make sure that you're watching yourself and looking for signs or symptoms so that you get on top of that quickly. I know that transference and countertransference issues happen for a lot of individuals. In the mental health field, it's easy for us to pass that individual off to another therapist or another counselor. But in the school system, that's a little more restricted. I'm a school counselor or a school nurse, and I have a student that is triggering trauma for me, and I'm having that counter transference, I don't have someone else in the building that I can just hand them off to because there's not another school counselor. So being creative, looking for someone within the school district who may can handle that student or address that issue may be something that we need to look at. So just keep this in mind that it's very possible to have that secondary traumatic stress. So some of the risk factors when we think about it, pre-trauma. So think about before the trauma happened. There's some individuals have domestic violence and family dysfunction. Some people have pre-morbid personality or short fuse. Some people have interpersonal relationship issues, and this is prior to the trauma. So when the trauma event happens, all of that gets magnified. Then you think about the paratrauma, the threat to their own life or exposure to death and suffering of others, or moral complexity. And I think when we think about this, you can really think about all those medical people and all those first responders who are exposed to a lot of the death and dying. And then, of course, the post-trauma, ongoing life stress, unstable employment, unstable relationships with ex-wife and son, poor social supports and networks. So thinking about all the risk factors that come into play later, we think about some employers, how they respond when they find out that an individual has PTSD or any mental health issue. We think about how family members treat them. I do know that a lot of individuals who suffer PTSD, that the divorce rate is higher for those individuals. And so it becomes a challenge all the way around. So some of the assessments that they use to help identify PTSD for individuals is some use categories of PTSD to evaluate are structured interviews or self-reporting questionnaires. There's clinical administered PTSD scales that have been developed by the National Center for PTSD. Preventive measures, positive mental health, education addressing stigma and resilience training, comprehensive treatment approach, making sure that treatment is individualized or individual based and not cookie cutter. And I think that's a big issue that I see a lot of times is cookie cutter situations. And then, of course, TFCBT is a very good fit for treating PTSD. So keeping in mind that PTSD impacts the spirit, the soul, the mind, emotional memories, and body. So it impacts the whole person. So whenever you're thinking about assessment and treatment, you have to take that holistic approach. So people coping with PTSD, these are some of the things that they deal with. And so this is what they're coping with. A lot of them are drinking. Some of them do drugs, driving fast. And just because you drive fast doesn't mean that's you. But a lot of times we see this as a factor, that living on the edge. Sleep problems, sometimes they, not work. Some people work at night and not during the day. For me, when I came back from Desert Storm for the probably first 6 years, I slept on a couch in the living room with the TV on because that's where I felt safe. Because one of the things that was ingrained into my mind was guarding the perimeter. And so for me, I was able to do that. A lot of times it was easier for me to sleep during the day because people were awake. And so I knew there were people who could watch and be alert. So that allowed me to relax and be able to do that quicker. One of the things you have to be careful about with people with PTSD is they startle real easily. So if someone has PTSD, it would not be wise if you want to wake them up to go grab them by the leg or the arm and shake them. Sadly, some people think this is funny. I have friends who have PTSD, and at their employment, people will throw wrenches on the ground behind them or slam something behind them real quickly just to get that reaction out of them. And so, keeping that in mind, they have to deal with flashbacks or hallucinations. Like I said, I don't even have to close my eyes to see all the destruction and devastation from the Persian Gulf War. Sometimes those dreams or those night sweats. People deal with depression and crying spells. So it's an ongoing situation. So some of the signs and symptoms, think about the hyperarousal, the hypervigilance or exaggerated startle, risk-taking, irritability, aggression and poor frustration tolerance, reliving those flashbacks, hallucinations, and nightmares of the incident, avoiding, and this is avoiding people, places, things, or memories that remind the trauma. Not only that, the avoiding also, as I mentioned earlier, is that avoidance of the talks and discussions that you no longer see as important or that you can't take part in. And sometimes that isolation has you to where you're not taking part because, again, you don't always want to share with people what you're going through. You don't know how people's going to take that information. Then you had negative thoughts and feelings such as guilt. For a lot of people who's been through trauma, especially veterans, they have seen their best friends and other individuals' lives be taken. And so guilt comes in with the fact of, for any individual that goes through a traumatic event, whether it's an airplane crash, car wreck, whatever, a lot of times guilt comes in because they're like, why did I survive and they did not? Why was it me who was left and they weren't? And so that sense of guilt of being chosen to stay as they see it. Then they have that flat effect where, their emotions, the way they dress things just has no, enthusiasm. They can have mood swings. So they could look bipolar. They could go from one high to one low extreme. They could have extreme physical reactions, reminders of the trauma, such as nausea, sweating, or pounding heart. And so some of these factors is where you get into those panic attacks and those panic disorders. And if you guys that's had training on panic attacks, I think about the little picture that we draw in youth mental health first aid that represents the panic attacks and that person shaking all over, feeling bad. For me, I can tell you there was several times that my whole body went numb from head to toe, and that was a scary experience. I've been so nervous that I stuttered, that I shook. And then, of course, you get into that place where that you can pass out because your body gets rid of all that carbon dioxide because you hyperventilate. So we have all of those different pieces that play a factor there. So more signs and symptoms, there's a loss of interest in life and daily activities. So here's where depression and PTSD kind of blend together. And sometimes individuals get treated just for the depression, but not actually for the PTSD piece. And so sometimes they don't get that full treatment that they need. And so that's where we really have to take a deeper look or closer an assessment. So again, that feeling of emotionally numb, being detached from other people, difficulty remembering important aspects of a tragic event. So anytime someone has a very severe tragic event, that PTSD, if it really is there, the hippocampus of the brain changes sizes. And we know that that's the area of the brain that stores the memory and allows you to recall it. And I can tell you that when I was in my heightened level of PTSD, that I struggled with memory. Because, for example, I was helping out the ladies at our church during a bake sale. And so they sent me to do delivery. And honestly, I didn't make it maybe 8 or 10 miles away from the church over the hill. I had to pull over beside the road and sit there for a while to think about why I came. And so sometimes recalling that information, I can also remember driving and not remembering anything from Man to Logan. And then I would be sitting at the red light at Logan trying to remember the drive to there. Sometimes there's invasive, upsetting memories of the tragedy. So sometimes, like I said, with sights, sounds, smells, those triggers can cause memories or feelings to flood inside of the individual's mind and life. And then again, that's difficulty sleeping or staying asleep. I know at one time I was lucky to average about 3 or 4 hours of sleep. I do better now. So when we think about the injury or experience sustained in deployment, so initially they may have been seen by someone prior to coming home from deployment. I can tell you that most of the time, unless it's super, super severe, a lot of them do not see someone before they come home. They may have been sent to a hospital in the area depending on the severity of the trauma. They might have been downgraded to light duty, working during and after deployment. So I want you to think about the impact of that just for a minute. Going back to what we talked about earlier, if you downgrade me in my duty, and I know for a lot of times people feel like that's helping, but for me, that may work on my self-esteem and cause me to feel worthless, because now I feel like you no longer see me as an individual that can do my job. And so that can magnify more instead of helping that. Then you get into the impact of being sent home from deployment due to medical or other issues. I can tell you that most veterans, if you will talk to them, even the ones who've lost their arms, their legs, most veterans would want to go back and be with their unit, because there's that sense of family, there's that sense of duty, and they would much rather be back there than to be home. To be sent home because of that sometimes is degrading and very embarrassing for veterans. Then you get into their inability to return to serve with their unit. And believe me, that's a big struggle. Knowing that your fellow veterans are there fighting and you're not there to help them or protect them. The change in income that occurs when no longer receiving the war allowances given while deployed, especially in the National Guard. National Guard units struggle a lot with funding because of how that deployment impacted them financially. How are we doing on time, Miss Stephanie?
Have about 7 minutes until the end of this session. We do have a 30-minute break between this session and the next. So hopefully, since we got a late start, participants won't mind staying over a few minutes if you have to run over just a couple minutes, Barry.
Okay, sounds good. Okay, so when we continue thinking about injury and experience sustained in deployment, they may have experienced killing someone during deployment. That is something that you just, it's hard to deal with and wrestle with in your brain, because especially if you grew up in a moral family who taught you about how that killing was wrong, that it's bad, that's a lot to deal with. They may have experienced seeing a friend or other close individual killed during deployment. They might have been exposed to bombing or other military procedures during deployment that triggers trauma issues. I know for me personally, I saw and experienced a lot of different things. I was in the artillery group, so I saw a lot of artillery rounds. I saw, a lot of fighting, different things. So there's different things there. The individual might have to take an early out and not be able to retire or continue current duty assignments. I was one of those individuals that did have to take an early out. I was not able to stay my full 20 and retire that way. But I also had some physical issues that I ran into that I had to have some surgeries and operations because of some physical damage that I had while I was there. Right now, a lot of people don't know, because I do very well with acclimating myself, but my hearing was greatly impacted. So my right ear, even with my hearing aid, I can hear sounds, but I really don't know what people are saying in my right ear. In my left ear, I still do pretty decent, but if I take my hearing aids out, I do not hear very good, especially if I roll over on my left ear, I hear nothing. And that really plays on my anxiety and stuff as well. So for example, me and my wife is sitting in the house and she hears it raining outside. She goes, "Boy, it's pouring the rain. Don't you hear that?" And I just look at her and laugh because I don't hear it. So, and then I have some other physical challenges. I had a heart attack when I was 30. Different things that happen because of my exposure. And so, thinking about those things, not being able to continue, the individual will have to adjust to no guard protection when returning home. It goes back to what I was saying earlier about me sleeping on the couch and feeling like I could guard the perimeter and sleeping more during the day instead of at night. When I was there, every hour somebody was watching. And so they were walking around the perimeter. You don't get that when you come home. The individual will have to reassociate themselves into the family. So much changes in the dynamics of the family when a veteran goes, whether it's man or woman, when they go and they come back home. Because that spouse that's left behind and those children that are left behind, their life adjusts to not having that individual there. One of the things I do appreciate is that now they're having shorter deployments. And so now 6 to 9 months, for a lot of them, they're coming home. But there was a time when some of those gentlemen and ladies would be deployed for several years. And so think about the dynamics of the family, how that changes within those couple of years. And that individual's coming back and now trying to reassociate themselves into the situation. And so sometimes families, not realizing they do this, sometimes they think, well, they've come back, now they need to relax, so I'll just keep doing and taking care of everything that I've been taking care of. Well, for those individuals coming back, now they feel like that they don't have an importance to their family because they're not being allowed to take care of all those things they did before they left for deployment. And then that relationship factor, whether that man or that woman has now spent a year or two or more by themselves, and so they kind of did whatever they want when they want. They watched what they wanted on TV. They ate what they wanted for dinner. Now this individual's come back, and life has to change all over again. And for anyone who's just been single for several years and then got into a relationship, you can kind of relate with that a little bit, how that your life has to change and be readjusted. So some of the implications of PTSD: there's a greater risk of other disorders. As we talked about earlier, 80% of people with PTSD generally have another diagnosis, such as depression, SUD, anxiety disorders. Of course, that substance abuse disorder is a big one. Greater unemployment. If someone's really struggling, and I mentioned this earlier for myself, I was not able to hold down employment at that time. I was a truck driver, and there were several times that my panic attack got so strong and so hard that I had to pull over beside the road and have someone come get me in the truck, and I'd go home. And so for a long time, I was not able to function. Relationships really, really take a hard toll because remember, we talked about earlier that issue with avoidance, that issue of hyperarousal, that issue of night sweats and flashbacks, and not being able to be involved in certain activities, that anger, all of those different things really, really take a hard toll on any relationship. Then you get into the health problems. And we know that whenever you have things like PTSD, your anxiety and all that's through the roof. And you know that anytime anxiety is up, the cortisol in your body stays at a heightened level. For the average person at nighttime, that goes down. But for the individual who has problems with anxiety and stuff, it does not go down. That level stays high. And because of that, then it attacks the body. It attacks all the organs of the body and starts damaging the organs. So you see health problems. Then, of course, violence sometimes a big factor because, again, for those of you guys who've studied ACEs and you've studied how that we get into that defense mechanism, that amygdala, how that it's constantly lightened and on the go, you find a lot more violence that takes place because they get involved in things because they always feel that need to defend or to respond back to a situation they feel threatened in. And I can tell you personally that that's not only a physical threat, but a verbal threat. If you feel like someone's challenging you verbally or embarrassing you in front of people, that can become attack. Generally, it gets worse. It causes you to have a worse quality of life. At some point, you do learn to deal with it and live better. I think I do really, really well now. There's only things that every now and then, my anxiety goes up. Every now and then, I have problems sleeping, not near like it used to be. I'm doing really well in those areas. Sometimes there are situations that I do avoid, but there's two things that I've noticed. I do every now and then have spells where I feel depression tries to come on, and I have to combat against that and overcome that every now and then. One of my biggest challenges for me still is if I feel like I've disappointed somebody. For example, if my boss, Dr. Barker, she comes into my office and lays into me because she just felt like I did and that I didn't do something right or whatever. For whatever it may be, if I feel like I've disappointed her for 2 weeks, I have to combat against the feeling of wanting to leave my job and go somewhere else because I felt like I let them down so badly. And so that's been probably still one of the biggest challenges for me. We're going to go through this slide and then I'm going to let you go because that'll put us about the halfway point of my presentation. So thinking about how that COVID increased our traumatic and our PTSD issues. During the recent pandemic of COVID, PTSD cases were on the rise across numerous vocations. And so it happened in every area, and especially in the medical, the firemen, the policemen, the first responders, it really increased. According to Dr. Laura S. Brown, PhD clinical psychologist, she says, we're dealing with an omnipresent continuing threat. Just as we have seen in recent military conflicts, there is no neutral zone or area of safety in these trying times. This is causing hyperarousal to increase, and the levels of stress have no opportunities to decrease. Of course, now things are getting a little bit better, but you'll find that there's still a lot of people who are still at that heightened point of needing safety, and they still don't feel safe because there are still some cases of COVID happening, and there's some of the variances that are now coming out. So this is still an issue. A study conducted by Mental Health America revealed that there were 169,243 cases found to have increased issues with depression or anxiety above the normal baseline prior to COVID. So we know that that's a challenge, and that's an issue in a situation for individuals. So at this moment, any questions at this point? And if not, then we will pick back up at the next point of time. Yes, part 2 starts at 11:30. All right, if nothing else, we'll see you.
Apologize.
Go ahead. Now you got sound.
Okay. Area and our gallery area. And thank you again, Perry. Hopefully we will not have these technical issues at 11:30. Thank you.
All right, see you guys at 11:30.